The work an MLS does is absolutely vital to patient care. We're involved in everything from identifying different diseases to identifying the best treatment options for patients. So we kind of have our hands in so many different aspects of medicine that it's really great to be a part of that and to be a part of the bigger picture when it comes to healthcare.
The role that an MLS plays in diagnosing anything from cystic fibrosis to multiple myeloma to any kind of leukemia, it can be that you are the one who is running the blood panel for that patient. It could be that you are literally taking that patient's blood and prepping a slide and putting it on a microscope and going through and counting the cells that you see individually in order to assist with giving that patient some sort of answers about what's going on with their body.
I like the hands-on of it. It is very much hands-on. You're using little tools, you're using a lot of chemicals, a lot of reagents, working with microorganisms and things you just cannot see, unless you use a microscope, of course. The main thing I like about it is that I'm part of the investigative team trying to find out what is causing the disease or condition.
You have to be super detail-oriented, you have to be fast-paced, you have to know how to multitask. And I like how lab is mainly behind the scenes in healthcare.
What I love most is being an integral member of the allied health team. We get to get a patient sample into the laboratory. Once they get into the lab, we can see how our part fits into the puzzle of the patient's condition.
With MLS, I love that it's just a bunch of puzzles to solve. Every new challenge that comes in front of you is something that you can solve with the skills that you learn in a program like this.
It's very important that everything we do is as accurate as it can possibly be. Those are people's lives that we're dealing with.
The ability to be hands-on about solving a patient's problem is just an unparalleled experience.
The MLS pass rate at UT Health is exceptional, and it's above the national average. And that really comes from our rigorous curriculum, but also the hands-on experiences that our students have.
The on-site practicums are actually one of the biggest reasons why I made the decision to come to this program. This is one of the few programs left in the country that still really does prioritize getting students into actual laboratory settings. The faculty who are in charge of this go out of their way to ensure that students get to do things that they are interested in.
We have the 4 core areas in our program. We offer blood banking, hematology, we offer clinical chemistry, and we also offer microbiology. And those 4 together represent the core areas of the laboratory.
One of the really interesting things about this program is that with the master's students, it prepares you for management positions as well as laboratory bench work.
We also offer special topics, which is more so an advanced level microbiology course to further support any type of infectious disease testing.
I'm really glad that we get specialized classes that can help us in that journey.
It's a challenging program, but if you put in the work, you will feel that you are ready to be an MLS and that you can do it.
Every hour that you put into this is an extra skill that you get out of the program that you can physically take to a laboratory and use to impress your future bosses.
I really enjoy seeing our students succeed in every way they can.
They're there for us through pretty much everything. It's been pretty great, I'm not gonna lie.